Okay, we're back from the break, and we have Roxanne on the phone. Roxanne, how are you doing this evening?
Hey, Roxanne.
Hey, I'm fine this evening, thank you. I have a question about diverticulosis, and I'm wondering if you can tell me a little bit about it. I know that it can turn into diverticulitis, and maybe you could explain the differences. And is there any way for it to heal, or any way to stop from getting any worse? And I'm going to hang up. I can hear you on the TV, okay?
Okay, sounds good. Well, that's a good question. Diverticulosis, first of all, diverticuli in general. The colon, being a tube, is fed by its blood supply from the outside in. So that blood vessel has to transverse the colon wall. And that makes a potential space in the colon wall. And so what happens over time, it weakens or it might enlarge, and it creates this weakness. And so the colon doesn't pop, but it just kind of acts like an out-pocketing. So you have the blood vessel that kind of goes along into this hole, and it creates this opening. And the fecal material, as it comes down, usually just transverses it. It won't get in there. But diverticulosis now is the act of that blood vessel being irritated and bleeding. Okay, so rectal bleeding, one of the causes for rectal bleeding is diverticulosis, amongst the other illnesses. Now, diverticulitis is an infection of the diverticuli. So if you're eating nuts or seeds and that happens to get in there and fit right into that opening, then the fecal material or fecal bacteria in your colon now are not being washed on through. They actually live in what we call an anaerobic or low oxygen environment, and they'll set up an infection. And that infection, if allowed to get big enough and long enough, will create an abscess. It's very painful. These diverticuli can rupture, and if they do rupture, they can put their infectious agents into the peritoneum, which is the cavity of the diaphragm all the way down, and that's very painful if you get a peritonitis.
It's very dangerous also.
It's very dangerous, and you can die very fast. You can die pretty quickly from, like, a ruptured appendix would be a good case of peritonitis, and you can get fulminant sepsis, and you can go into septic shock and DIC and da-da-da-da-da. So the way you prevent diverticulitis is that you have a very, very loose stool, not liquid, okay, because diarrhea is not the thing you're looking to do, but you want to make sure you have a very, what we call, low transit time. You want to make sure that you have a lot of fiber or a lot of...
and that food is going through you.
Right.
Really, not quick, but it's going through you consistently. It's not backing up in the colon.
Correct. So you have to be well hydrated. You have to have something to hold the water in the colon. Now remember, the colon's job is to reabsorb water. So back on the subject of absorbing water. So if your food, your substance you eat, you drink, a lot of fluid with it. Basically it's a chyme. It's very mushy, and so as your body takes the nutrients out, takes what it wants, it leaves behind what it doesn't want, which is a lot of fiber, a lot of bulk, a lot of agents. It just can't absorb it. And it's moving it through your intestinal tract, and then it gets to your colon, where your colon job is to basically, squeeze every bit of water out of it that it can, to create a stool that, if you're constipated, you get a rabbit type stool, the pellets. And then if you have a normal bowel movement, it's loose, it has some consistency, but it's not watery or runny. So, and you should be having a bowel movement every day. Now, there are things that change that, obviously, as you get older. The motility of your bowels it goes down if you're on medications like opioids or pain medication or muscle relaxants. If you have an overactive bladder, any of those things that affect that will affect colonic motility.
And we go back to hydration, and we go back to movement and exercise. People sit too much. People don't get up and move.
Yep.
And you'd be surprised getting that. That's why 20 minutes in the evening, a good walk, And a big bottle of water is so good for you.
Yeah, no, it is, and you're right. It does, being water and being movement does help your bowels move. So the more you're moving them, the less the colon has a chance to absorb all that water and create constipation. Now, you live in the desert where you can get dehydrated before you even get outside.
Yep.
You know, if it's hot in your home, you're going to lose more fluid. So getting back to preventing it, it's making sure that you drink enough fluid during the day. It's very important. Making sure that you have fiber in your diet, okay? Because fiber holds water. So there's a tug of war that goes on inside the colon. If you basically take something like a plant fiber that has to hold water, the colon can't take the water from it. Okay, and so that's why high fiber diets add in bowel, in bulk and in stool movement. If you eat a lot of meat and a lot of roughage like that, you know, lettuce and stuff like that, the opposite of that, then the more bread and potatoes and other things you eat, you're going to get more constipated. But the more fiber you have in your diet, the better you're going to have that. Now, with that being said, Metamucil is one of the better fibers out there. One of the problems with fiber in general is that it can produce a lot of gas. So Senna, S, and those products of vegetables fibers, they can be digested by some bacteria and they cannot be refined. Metamucil is the actual psyllium fiber, very well refined. In fact, it's the one that goes through the most refinement. So it's one of the better ones. So that's what I recommend. Now, Miralax and Glycolax are glycolated proteins, and they actually hold water in a different manner. But it doesn't matter what you use. Your personal preference. But the point is that good water in that will help transit time, and that will create a situation where you can prevent more diverticuli. If you're straining to have a bowel movement, you're putting downward pressure, okay? And that stretches and weakens the colon a little bit, and that can cause a problem. So you need that decreased transit.
Well, the large bowel is essentially a series of smooth muscles.
Yes, it is.
And they have to be stimulated.
Yes, and they have to move in conjunction. So they start with morning. You know, why do most people have a bowel movement in the morning? Because when you eat and swallow, you start the motility chain all the way down to the abdomen.
Absolutely.
It can be stimulated by caffeine and other stimulants. So obviously if you're up and you're walking and you're eating does it. You're up and you're walking and you're drinking fluids, you're drinking caffeine, you should have a morning bowel movement. If you don't, then chances are that in itself could be a problem. Now, the other thing people do sometimes is they get busy at work, okay? And they get busy in their job. And they don't respond to the natural urge to go to the bathroom.
Yeah,
okay?
they put it off.
They put it off. And you put it off and you put it off, and you train your body to put that off and put it back. So what you're doing is you're delaying the inevitable, and you're creating more opportunity for more constipation, and then it backs up. And that's the thing you should not do, is delay the urge to have a bowel movement when you get the urge. And even if you don't, and what I have to educate some patients on is that even if you don't go to the bathroom, you need to retrain yourself. That means even after you eat and you don't feel like it, you go sit on the pot for a minute. Okay? Don't sit there long enough to read the Bible, but sit there long enough to pretend like you're going to go. And if you don't go, that's fine. You get up, and every time you feel the urge, you get down. And sooner or later, you will retrain your body to have a bowel movement when you get the urge and respond to that. So that's how you prevent diverticuli in general. Now, there are some people that genetically just have weakness in their colon, okay? And you usually see those people, and I've seen a few of them, they're 35, and their colon is full of diverticuli. Now, some people have to have colonic, partial colectomies, or removal of the colon, because there's so many diverticuli and so many infections. And they get scar tissue, and they get a lot of other things in those areas. But and if you do have diverticuli, and you won't know it until you get an X-ray, or you get a colonoscopy, or you actually get one of these things infected, and you show up to the emergency room with left lower quadrant pain, really severe fever, chills, okay?
Point tenderness.
Point tenderness, yes, that could be part of the peritoneum being infected, and then that would basically mean now you have diverticulitis, and from that point on, you're going to have to stay away from nuts and seeds and things of that nature. That means no popcorn. Popcorn is the worst offender of diverticulitis. It's the number one cause of diverticulitis because you don't really chew the popcorn very well, and those little kernel
and it doesn't digest.
It doesn't digest. Exactly right. So I hope that explains it to you. Diverticulosis is bleeding from the diverticuli. Diverticulitis is a blockage of the diverticuli, which causes an infection. You can have both at the same time. You can have neither. The key to this disorder is good, soft bowels that move on a regular basis. If you're taking medications like opioids, there's a new product out called Movantik. Movantik is a medication that uses an opioid antagonist, naloxone, which they would give a lot of people, but it's used in the bowels and it stays at low doses. It affects the bowels and helps to do that. There are other agents that have been used, and I know we have a lot of people on pain medications. But the quickest way to do that is to take a lot of fiber if you're using pain medication. So anyway, we're going to go to break, and thank you for that call, Roxanne. It was a very good question. I appreciate, hope that I answered that for you, and we'll be right back. And thanks for your input too. Thanks.